Thank you for tuning in to watch Creative Health in the NHS, where we'll be asking the question, how can we use art and culture to make our hospitals healing environments? This event is brought to you by our South East Creative Health Associate, Esther Watts. To access other event recordings hosted by our regional team, please visit the NCCH YouTube channel and select our regional playlist. Now, without any further ado, let's pass over to Esther.
Thank you so much for joining us in this timely fashion, and welcome. Please do put in the chat if you haven't already to introduce yourself, but I'm just going to start. I'm going to share a couple of slides just to set the scene, and then we will be straight into our very interesting speakers, so please do bear with. So welcome to Creative Health inside the NHS. How can we use art and culture to make our hospitals healing environments? So welcome today. The plan for today is this brief introduction from me, and then we'll be hearing from Ruth Charity, who's the lead for the South East Hospital Arts Network, but also in her day job is Arts Lead at Oxford University Hospitals. We'll be hearing from Dr. Jane Stevens. Dr. Jane Stevens, the Associate Medical Director at Dartford and Gravesham NHS Foundation Trust in Kent, and Lucy Wells, the Arts Lead at Sussex Partnership Foundation Trust, which is a mental health trust. And finally, after we've had the speakers, then we're going to have a Q&A to the panel and a discussion. So please do, without further delay, let me just, if you're not aware, I just wanted to put in context what we define as creative health at the National Centre for Creative Health. So they are approaches and activities that have benefits for health and well-being, but that can be anything, both from knitting to creating performances or visual artworks and everything in between: film, writing, cooking, creative activities in nature, gardening. They can really make a creative and innovative way to support health and care services, co-production, education and workforce. And we'll be hearing about some of that from our guests. And it can be applied in many different settings, but in this webinar, we're talking about hospitals in particular. We believe that this can really help the prevention of ill health and promote healthy behaviours, management of long-term conditions and treatment and recovery across the life course. So it's a really brilliant intervention for targeting specific conditions, but it's also creativity is one of those joys in life that can help support us with our health ongoing. It's not something that we should be doing on a regular basis. I just wanted to share this brilliant image from a nature photography work. It's a project run by South Downs National Park with a social prescribing organisation in Brighton called HERA Partnership. And I just love that the message here that your body is a landscape, not a battlefield. Creativity and creative health in hospitals is mentioned in the Creative Health Review. So this is one of the seminal works for the National Centre for Creative Health, but the all-party parliamentary group on creative health did their original report in 2016, but we have now updated it in December 23. And you'll find, if you turn to page 32, you'll find the references there and some brilliant information about creative health in hospitals. And also just wanted to give a quick mention to the Creative Health Toolkit, which we have published. And this is a really interesting and sort of work in progress piece of resource that we are going to also ask you to support by putting if you've got brilliant examples, we'd love you to put those illustrative examples onto the Creative Health Toolkit, but we'll write to you afterwards to talk about that more. And then I'm going to stop sharing and hand over to Ruth. So Ruth, you're up.
So my name's Ruth Charity. I'm the Arts Lead for Oxford University Hospitals NHS Foundation Trust. I'm also on the steering group for the National Arts in Hospitals Network. And I will put my email in the chat afterwards for anybody who is an arts manager working in hospitals who might like to join the network. We've just relaunched under the umbrella of NHS Charities Together. I also chair our East and South East network group. So again, if you are interested in that, you don't have to sign up to be a member of the national network to be part of our regional groups. And they are very informal and they are designed to support and share good practice throughout the region. So I'm going to focus my 10 minutes on the environment, because I know others are talking more about engagement for patients, visitors and staff, and really just focus on creating a healing environment within hospitals. Often hospital spaces are rather cold clinical spaces. People are coming into hospital often very stressed, very anxious, and really I think the visual arts have a really key role in changing the mood and feel of hospitals and supporting not only patients but their friends and family and staff who work there. So I think initially one of the ways that hospital arts can really change the environment is to bring in colour and imagery and a welcome to, as soon as you step into a hospital, to feel differently about the place. This is a very large artwork at the entrance to our children's hospital, which hopefully changes the view of children as they come in to what might for them be a very scary place. Then there are very kind of specific roles that art can play. This is an artwork commissioned for our bone marrow biopsy room. And it was a room where patients lay on their side and looked at a plain white wall. We worked with artists to create a view with a windowsill, a kind of trompe-l'oeil windowsill, so that for those patients, their mind was taken elsewhere when they were undergoing quite an uncomfortable and sometimes painful procedure. Similarly, with all our work, we work very closely with staff on developing new artwork. This is a room that small children go to when they've inserted a bit of Lego up their nose or in their ear, or basically it's a room for removal of things from different orifices of children. So it's very stressful. We work very closely with play specialists to find a huge amount of distraction, things to count, things to spot, so that your mind and the mind of the child, and often its supporting parents too, is taken elsewhere. Focusing on young patients, we often work throughout a whole ward, and I think this is where it's really important to think of whole environments. So on a child's ward, each child has a bed space with an icon, and they can find that animal or bird throughout the whole of the ward. So they can pick up on it in a corridor when they're going out to sort of to play spaces. They can find it on the ceiling of a treatment room, and it's the idea of a character that stays with you. Again, really important to support young patients, to give them a sense of fun and play in somewhere that can be quite scary. And I just included this quote from a parent that I received last week, which actually illustrates that for parents, artwork is important. They are often more stressed than their children. Thinking about older people, we often use artwork. Artwork can be used to prompt memory, to prompt conversation. This is an artwork that was commissioned for a trauma ward, and one of the prime aims behind the artwork was to get patients out of bed and moving. And if you've got something interesting to go and look at, you're more likely to move out of bed and move down a corridor. So it's used by our OTs and physios. We also have a bus stop in it. Often older patients want to go and sit by a bus stop and feel calmer. It's very interesting. It comes up time and again that to sit by a bus stop, people feel they're on their way home, and then they forget about it and go back to bed. So we worked with staff and patients and chose their favourite things, and the artists included all their favourite things within the artwork. Also, we're supporting families. This is a programme of work that we created for a ward department within our women's centre, where parents go when they've lost a baby. We worked very closely here with donors, and it's really important, I think, that these are spaces that people have in their heads for a long time. They're spaces that stay with them during the most traumatic of times. We work with a wonderful artist, Ella Duran, who's created this kind of meadow within the glazing, which looks onto a garden, and artwork for all the rooms. and worked with Laura Carey for an artwork to remember those children who have been lost. And each little butterfly on the wall is then replicated in a butterfly that parents can take home with them, so they have a connection back to the ward. So I think often people forget about the families, but families are really important to support within hospital environments. We have an exhibition programme, as do a lot of hospitals, and I think one of the reasons for this is to create a talking point. People often run out of conversation when they're stressed. They can't think what to talk about. So our exhibitions and exhibitions in general are points for conversation. Again, when people just are focusing on why they're in hospital or why they're visiting in somebody in hospital, something that can take your mind elsewhere is really useful. This particular exhibition also has another layer in that it was an exhibition that looked at decorating photographs of patients with scars with gold paint, mimicking the kintsugi way of, which is a Japanese method of repairing broken pottery with gold. And this we found has been really supportive for patients who've got scars, and we've actually then been able to use this imagery. The clinical psychologists have used this imagery to support patients who have scar damage. Safe spaces for staff are also incredibly important. So we do a lot to use colour, furniture, artwork to create really calm, relaxing spaces for staff to de-stress. And I just want to end by quickly going through a project that we did for our emergency department resus, just to talk about the power of colour and biophilia. We worked with an artist, Jackie Poncelet, on the colour for the whole area. It was originally going to be white with grey wall protection and splashbacks. And in terms of cost, the cost was very little to change the colours. So Jackie worked with the architect to create a palette of colours that are then applied on very ordinary elements: architraves, doors, splashbacks, wall protection. We worked with an artist, Una Cully, on nature-based imagery for the department. Light boxes on ceilings to distract patients when they are going for a CT scan, with a lot of detail in so that you are absorbed. I think people often think children need distraction but actually adults do as well. This is a door onto a paediatric bay with privacy by opaque glazing at the bottom and then transparency at the top so staff can see in. And again, just trying to create this biophilic image, which those of you who've read Roger Ulrich will know all about, that the fact that even images of nature have a calming and soothing effect. A room for patients with mental health needs, ceiling tiles for the bays, again having to try and keep the imagery very, very calming and appropriate for those who might then be in quite difficult states, in difficult mental states within an emergency department environment. And not forgetting staff. The staff we worked with were very keen that we introduced artwork to a very small room off the CT scanner area where staff didn't know whether it was day or night, so we introduced a light box there. And then spaces for relatives to wait, often waiting a long time in emergency department, and using artwork to create a calm environment, and colour choice for furniture as well being really important. I thought I'd just put in a couple of slides. Of course, artwork, art programmes that are around engagement are really important. Music, creative activities for patients at bedsides are vital, and for staff we've done a lot of projects, particularly since COVID, to engage staff and to show projects that are about listening to staff, projects that are about engaging staff in mindful activities such as origami or our staff choir. So that's my whistle stop. I will move back to Esther now. Thank you.
Thank you, Ruth. Thank you so much. There's so much amazing work has gone into those wonderful pictures, and how lovely for staff and patients to be around those. If you've got any questions, we're holding them up until our discussion, but in the meantime, I'm going to welcome Dr. Jane Stevens, who's from Dartford and Gravesham Hospital Foundation Trust, who's going to talk about her work supporting staff with wellbeing.
Thank you, Esther, for inviting me to talk today. And thank you, Ruth, for your beautiful presentation. Even looking at those images and that artwork through my computer screen, I experienced the sense of soothing that the artists were, I'm sure, intending to create. And also I want to say, listening to your beautiful voice was also very soothing. And in many ways, that's part of creativity. It's everything. It's everywhere. It's something coming out of nothing. It can be a conversation with a friend, a piece of artwork that we listen to, music, an insight that's just personal to us. So creativity means so much for me. I think I try and sum it up in the words freedom, movement, and spark. Forgive me now, I'm actually going to talk a little bit about myself. And I'm reluctant to do that in many ways, but I think to illustrate my interactions with creativity and how it can support staff and help them not just to survive but thrive in the workplace requires a little bit of context from me. So I was once a haematology consultant who would have been doing those procedures that Ruth mentioned, the bone marrow biopsy. I probably did thousands in my day, usually with my patients looking at either a blank wall or a collection of medical junk, probably. So I worked as a consultant haematologist for many years. When I became a consultant, I became interested in what I now call, didn't then, but do now, the ecosystem of the hospital. The reason I became interested in the ecosystem of the hospital was I figured out that unless I was able to be in an environment that supported me and sustained me, I would be unable to flourish as a healthcare professional. And that interest took me on a leadership journey in the NHS. The leadership journey for doctors tends to be clinical lead, then clinical director, and then you get up higher and closer to the boardroom. And I had the opportunity to do that. I was working in a hospital that was very challenged, and during my leadership tenure, it went into special measures. Those of you that aren't familiar with NHS jargon, that means the hospital is literally sitting on the naughty step and being told off regularly. It generated a kind of culture of ruthlessness amongst the executive team and directors who were determined to get the hospital out of special measures. But I unfortunately experienced that as ruthlessness, and I found that very difficult because that wasn't why I had gone into medicine or medical leadership, and I found a misalignment, one might say, with my values. In 2016, after some very difficult things that happened, I elected to leave the hospital, my career, and the NHS completely. It was a bit of a biographical rupture. It was quite shocking for me because I was a very, I thought, passionate and dedicated doctor. Very few people understood my decision, least of all my mother, who said, well, what are you going to do now? I didn't really have a clue, but I had just finished a master's program and thought, well, I might as well go on and pursue the threads that interested me about the master's into a PhD program. And so I was fortunate enough to do a PhD program in action research, which is participatory research, and in some ways enables you to experience your life as a doctoral inquiry. You can't get much further away from a scientific paradigm PhD than you can to action research. But actually, it did allow me to interrogate my experiences and try and understand why at that point my career had come to rather a sticky end. But also to think, well, what's happened here that took a passionate, a dedicated doctor to want to leave everything? What's gone on here? And one of the things that my PhD very much settled on was the experience of staff in the NHS, and looking at that. And it was during my PhD time, when I wasn't otherwise engaged, that I was asked to come into a hospital where they had suffered a terrible, terrible tragedy, and that was the suicide of a doctor who wasn't dissimilar in age to me. And I was invited into the organisation to look at whether there were any omissions or failures on the part of the trust that had led to this tragedy. And as I spoke to the staff that were around this particular doctor, his family, I realised a parallel process was going on. I had managed to pull myself back from my metaphorical cliff edge, but it really galvanised me. And I was looking at how I could continue in terms of my PhD doctorate, that line of inquiry, when COVID came along. And obviously that threw everyone out of kilter. But the hospital invited me to work with them during COVID, and I had my GMC license reactivated, so actually I could work clinically again. So I rather nervously went to the medical director and said, I will do anything you want me to do. What would you like me to do? And actually they said, well, could you figure out, given your background, our staff support services? So I was very happy to do that. So I found myself an office. I opened the door of the office, I opened my heart, and I opened my ears to the people that wanted to come in and talk. And I spent about 18 months listening to staff. And actually, I found that's what they needed. They needed to be held in a space where they felt safe and they could talk about whatever it was that was on their mind. I am now, you've perhaps seen my title, Associate Medical Director for Wellbeing and Workforce. I believe I might be the only one with that title in the country, and it feels like a great privilege to do that work. But given this is about creative healthcare, I think I need to get back to why I think creativity and healthcare is important. So I'm just going to share with you a couple of things that we're doing. And the first is, many of you who work, I don't know how many actual NHS employees we have, but we have a new patient safety reporting framework called PSERF, and that's underpinned by something called a just culture. A just culture is one that is based on restorative justice. So retributive justice asks who did what wrong, how can they be held to account, how can they be sanctioned, and what compensation is due to whom and to where. It's very punitive and it hurts people. Restorative justice has a slightly different take, and it asks the question, who got hurt by this? Who will support those that are hurt? And how will they do that? Now, of course, in patient safety incidents, patients get hurt, families and loved ones get hurt, but so do staff. And because my opportunity here is to talk about staff wellbeing, I want to just think about staff getting hurt through patient safety incidents. And if you ask the question, who has been hurt, who will support them, and how will they do that? Right there, I see an opportunity for creativity, for thoughtfulness and engagement with another human being about how we might support them. And that's, I think, where arts-based interventions do come in. And we've been talking this morning on a separate call about poetry and how poetry can really help to piece back together minds that are fragmented by trauma, by upset. So that's one of the things that we're working on in our organisation. Whenever there's a patient safety incident, we look how we can creatively support the staff who have been hurt. Another strand that we have in our organisation is that we take people into the forest. we take them on retreat, and we go into the forest and we do something called forest bathing, which is an invitation to be in nature, but also to engage your five senses with nature and experience nature in that way that we've seen Ruth describe in her imagery and in her artwork, how soothing nature can be. As well as doing the forest bathing with the staff that we take to the retreat centre, we also practice something called sophrology. Now, most of you won't have heard of sophrology, and Esther, I might ask you to type the word into the chat, because it is not to be confused with upholstery, which is also called sophrology. You'll have seen the adverts on Channel 4, but sophrology as a practice is the study of the consciousness in harmony. Sophrology uses mind-body practices, it uses breath work, and importantly, it uses visualization and imagination for well-being. I have my sophrology exams in a few weeks. I've been training as a sophrologist for the last 2 years, and having trained as a doctor and done a master's and a PhD, I have to say sophrology is the best thing I have ever done. It is absolutely amazing, and I'm really evangelical about it, and I make no apology for this, and I'm happy to send around some more information about sophrology. So having done forest bathing and having done sophrology, we also do storytelling with our staff, and the storytelling sessions that we have as the final part of the retreat programme have been incredibly powerful. We started the retreat programme as post-COVID recovery, and we continue it now because it still has meaning and purpose to so many people to create a bit of space in their lives for something a bit different. And the final thing I think to say is that we're going to have a creativity healthcare conference at Dartford and Gravesham Trust in September, and we'll be looking at how creativity can help staff not just survive but thrive in their roles. So if anybody is interested in joining our conference, be very welcome, and Esther will help me with advertising that, I have little doubt. I hope it will be the inaugural conference of a yearly event, so let's think big. So happy to be with, wow, 41 people on the call today just talking about this. I'm sorry it's been a bit me, but I am so excited about the potential for just allowing a little bit of creativity back into healthcare delivery. So really passionate about it, and look forward to engaging with you at the end when we've had our third speaker. That's all from me. Thank you, Esther.
Thank you, Jane. Thank you. So helpful for you to share both your experience and what you're doing over at Dartford and Gravesham Hospital, and that amazing support programme for staff and their wellbeing. Next, we're zooming on to our next speaker, and there's time for questions later, so please do patient for 10 more minutes. Now we've got Lucy Wells, who's the arts lead for Sussex Partnership Foundation Trust, NHS Trust. Lucy, would you like to take the floor?
Yeah, hi, thanks for inviting me, and it's really, yeah, I agree, Jane, it's really great to be here, and I could have listened to you all afternoon. That was so interesting. But yeah, I've got a few, I might have gone a bit wild with my amount of slides, but I'm just going to share with you, and we can whistle through them if it all gets a bit too much. So yeah, similar to you, I'm going to talk a little bit about myself, but I just thought I'd give some context, and also where I'm at and where I'm from and what I'm doing to hopefully feed into this conversation. I think Esther loosely broke this down into 3 sections of environment, staff, and then service user, patients, people basically. So yeah, I think we're all here because we know that this statement is true, that access and engagement to the arts is recognised as a significant determinant of health. Although, of course, we do always come across corners where one needs to be more evangelical about that and do a bit more kind of convincing than others. But I feel like I'm preaching to the converted here, hopefully in this space. But just knowing that it is a vital component part to helping us live well, whether that's socially, emotionally, mentally, and it brings meaning and connection. Yeah, and that it's good for us. So I work for the Sussex Partnership NHS Foundation Trust, and I head up their arts and health service, which is called Make Your Mark. Our mission is the service is to really integrate art into the fabric of our healthcare. So that's my role. Hang on, I'm a bit confused by my own slides here. I'm so sorry. Oh, it's because I'm sharing the wrong presentation. Huge apologies. Okay, so yeah, so Sussex Partnership Foundation Trust, we're NHS, we're a massive mental health trust. But we specialise in providing mental health care and learning disability and neurodevelopmental services for people in the southeast. So we're West and East Sussex and also Brighton and Hove. So it's a huge geography and a very diverse corner of the country. And it covers everything from inpatient, community rehab, secure and forensic services, CAMS. I mean, that we do have, there's hospitals, of course, but all sorts of different clinics and sites. And we have a huge workforce of around 5,000 people. So me, yeah, so that's my role. I'm the lead for the Arts and Health Service here. But just as a quick kind of background, it was really great to hear your journey, Jane. I think to understand how we arrive in this kind of environment of health, but with this belief and drive to have art as part and parcel of that experience and the vitalness of that. So I started out as an artist. I've kind of, it's waiting for me. I'm not actively working as an artist at the moment, but I started out as an artist, but was quickly interested in how art and people come together. I ran a little arts company with an occupational therapist for a while in Southampton. I went back and studied back at Goldsmiths, where I'd done my undergraduate. Look at really kind of in cross-sectoral and community arts. And I think really where I cut my teeth with people and art and the importance of bringing them together for mutual benefit was at the Bromley by Bow Centre, which is a really interesting health and wellbeing and community centre in deep in the East End of London. At its heart is a GP practice, but it has all sorts of other services from there, from finance and welfare advice through to dietary and health, and debt and housing. And my role there was the inclusive arts manager. And it was a unique place because it had art and artists at its heart. So that you might have come in because you've got a physical issue, but actually you can brush up against all these other parts of who you are and meet and connect others there. I then moved from there to South Bank Centre, where I ran the communities programme. So really kind of getting deep into the art space and how you can bring people who are often excluded from those arts and cultural spaces and conversations and stories to try and crack open these big sort of cultural places that can be very excluding and often excluding to those who arguably can contribute and perhaps need it the most. And from there, I wound up at the Trust running their arts and health service. So from deep in the arts world to deep in the health world. But essentially, the main thing about me is that I do believe that art needs people and people need art. And I think absolutely creativity and culture and art definitely is a vital part of being human. But equally, good art needs people, and it needs all sorts of people and all sorts of stories. And I love that. I love that exchange of those two things. So oh, I kind of said this at the beginning when I was reading from the wrong presentation, my apologies, I'll skip along. But just to quickly say how it works here at the Trust is that there are lots of creative therapeutic psychotherapy provision, but there's no core budgeted provision for the use of and access to the arts and cultural engagement within the Trust, which is where my service comes in. So the history, our service is called Make Your Mark. It was the baby of a real visionary art psychotherapist back in 2015, and she was really keen, although she could see all the really brilliant stuff that was happening in the psychotherapeutic spaces, to take art and people and connect out, and it be a means for connecting outwards as well as inwards. And she started off by working with our Trust. There was no budget, there was just her. So she worked with our Trust charity, which is called Heads On, to fundraise, to run some pilot programs, which they delivered through our recovery college. And then this kind of really mushroomed and grew with her flagship program of Year of Drawing. She stepped back into being an art psychotherapist, and then that's when I came into post. So Make Your Mark now sits within our wider Engagement and Experience Directorate, which is an interesting collection of services, from chaplaincy to equality, diversity and inclusion, to complaints and PALs, to our participation and peer support services. But fundamental to how we function is that we collaborate with our charity to raise funds in order to deliver new and live projects. And it's got these we have these two kind of key focuses. First and foremost, our patient experience, but absolutely and connected in an intrinsic way is our staff experience. So not only having access to arts and culture and creativity for both of those communities, but also with our staff, it's really interesting. I feel like there's such opportunity for learning, skill development, and also staff retention. My ears were listening keenly to some of the challenges that you yourself face, Jane, but I know that I'm sure that's chiming with lots of people in this space today, but certainly I know here amongst my colleagues too. It's a small team, it's just me. I'm part-time, 3 days a week, so in a huge sprawling organisation, but we have to be kind of innovating in how we can increase access and opportunity for creativity to happen for the communities that we serve and also our workforce. And we kind of have that in two strands. One is working, as I've mentioned, with our charity to develop and then fundraise for new trust-wide arts projects for our service users, their friends, families and carers, and then also looking at what we already have. So our kind of galvanizing existing creativity, which is rife, but it's often hidden and it's often disconnected. So some of our new stuff, I just thought I'd give you a couple of examples just so you can get a real feel for the sorts of things that we've been up to. So I mentioned Year of Drawing, which was an amazing project, which was set up and delivered by my predecessor. And it was trust-wise, so across all different services and spaces. Key to it was connecting in partnership with community and cultural organisations. They had all sorts of participatory public and then smaller invited events and workshops and pop-up studios. It was an extraordinary project and really brought together people, place and space for some amazing art to be made and connections to be built. And I think, as I've put in this slide, empowerment to be found. And then more latterly, in terms of a really large-scale cross service and cross space, and another big partnership project working with some arts organisations and a tech company. We created a huge online programme working with artists and performers and speakers. I can put the link in. You can go on our YouTube channel and you can connect into these, because they were live streamed, so they were participatory and interactive. But we recorded them and have put them up for people to use, and in fact lots of our occupational therapists still use them. They tap into them as like these really brilliant resources to connect into. But again, I just think that voice and affirming how significant it is that art is part and parcel of who we are, and that my role and our role here at the Trust is to find ways to make that available to people, about it being a lifeline, a source of connection, joy, and it's helped, this person said about it helping find a part of themselves again. So this other interesting strand of how we can find ways and be kind of, I was going to say by hook or by crook, to find ways to bring creativity into this often very medicalized and clinical world, is looking and supporting existing creativity, and kind of galvanizing that and looking at structures that we can start to create, which mean that we can embed it into what is often a very under-pressured, under-resourced, and in certain corners burnt out workforce and spaces. I think a really interesting development that we've started here is it's a staff network for music, so people who love music, and we've got people in this network from our facilities team to an estates team to administration through to occupational therapy, the expected occupational therapists, brilliant people. And we get together, and it's just to really look and see what we've got and how we can use it together and how we can come together to try and create more opportunity and to create spaces and experiences and participation for the communities that we serve. I just wanted to show you, because this was a really exciting and another really good example of how we can connect our health and well-being to the wider sense of who we are. And that includes us as people, but it includes those that are around us and the communities and spaces that we live in. We've been running a series of DJ workshops with a local bar in Hove called Rockwater, with some really exciting DJs, not least Fatboy Slim, which is how we managed to get this one on the news. But I just thought I'd show you a little tiny clip of a couple of the brilliant participants who came along to this workshop. I'll just flick it along to here.
I'm Jess, I'm a drummer and I'm from Brighton. I'm Amber, I'm 26 and I'm from Eastbourne and I love to sing. I've been in dark places pre and post COVID. I've been in psychiatric hospitals at parts of my life. I don't think it's something to be ashamed of anymore.
Oh, right, and that was bang on.
I was already on there and he came over.
Right, how you doing?
I'm good, thank you. Doing something like this, it just proves to me I can step outside of my everyday routine, even though before I even got to the door I stopped, but can you actually do this? Anxiety just overtook. The feeling I feel now will mean that I will push myself next time.
It was joyous being involved in this workshop because the people hadn't ever seen or touched decks before. I kind of take it for granted because they're the tools of my trade. But seeing someone going, oh, we can do that, it's a beautiful thing.
There's a lot to it, isn't there?
I know, yeah.
I was going to always, whenever I've in any group or committee or presentation, I always think when we're talking about art, it's always good to experience art. But I don't think we've got time, have we?
We haven't really, sorry.
No, I'm sorry. Apologies, Esther.
Yeah, well, we can click on it afterwards. We'll send out the presentation. But it would be really nice to receive any questions that you've got. So if you want to put your hand up, we can, and you can unmute yourself and ask your question. But we've got one which is a nice lead in, which is how do NHS trusts access funding to develop their creative practices and projects? Which I think is a good question.
Shall I take that one?
Yes, please.
Okay, so with great difficulty, there was a lot of money during the time of COVID, thank you to Captain Tom walking around his garden and raising an extraordinary amount of money for the staff well-being during COVID. And that was how I managed to fund the retreat programme for the first year. The second year it came from our in-house hospital charity that still had a residual staff wellbeing fund. This year I was told in no uncertain terms that there would be no money coming from their hospital charity and that they were a charity that was not for staff, they were for patients only. And that was very hard to hear. So I've been rather gloomy about it all until last week, when it was announced that there is a new NHS Together charity pot of 16 million for all 4 countries in the UK, but I think it is probably a bit England heavy, I have to say. And that money will be available to bid for NHS hospitals and I think wider NHS and social care organisations. The T's and C's aren't out just yet, but the fact that there is money that is earmarked for staff wellbeing projects is hugely important to the work that we're trying to do. So let's all get good bids in early. Let's get started now so that we're ahead of the game when the T's and C's do come out. I know that they will be looking for data, and it's really hard to get data. But I think if you have a decent number of testimonials and people saying, this is the material difference that it made to me, I think that that is going to be really important to support your bids. So it has been really tough, and I see a bit of a light. I hope it's going to come through.
And Ruth, do you want to speak to this?
Yes, I mean, it's always the hard bit, the money. I'm actually employed by our hospital charity, and our hospital charity does support staff as well as patients. So if it's helpful, Jane, I'm very happy to pass on our kind of hospital charity ethos, if that would be helpful. I think one thing that is really important is that there was a lot of emphasis on staff wellbeing during COVID, and it is still really, really important.
Yes.
And I think that often people think that that's done now, ticked off, but staff are still in situations where they really, really need our support. I have found that evaluation is really helpful. We did an evaluation on our staff choir, which was run for us for free. And we had over 40 people giving really fulsome responses. And that gave the evidence base to be able to argue to our charity to fund it.
Right.
But it's always the tough bit.
Yeah.
And Lucy?
I mean, it's always a question that comes up because it's always a pressure. And I think, I mean, the service that I run essentially has to behave like a small arts charity and do that whole process of fundraising and I think absolutely there's the places where there's money attached to kind of health initiatives, but there's also money attached in the art world to the kind of art initiatives. And I think Make Your Mark, certainly, that's generally been its focus. And actually it's really encouraging. I know obviously the Art Council is this like one kind of the mothership, but by no means the only place where funding can be sought from. But I do find it really encouraging that there is much more. If I think for the 25 years that I've worked in this field, there is much more a coming together of an understanding how health and art are so closely linked. I think there was often a separation. I don't know, NHS and Arts Council kind of were born within a couple of years of each other, but somehow it went like that. And I don't want to be kind of naively optimistic, but I do think conversation has shifted. And what I think one of the silver linings of the awfulness of COVID was actually there was a much more mainstream recognition of creativity being so vital to us living well and connecting well. But it is an ongoing challenge that I myself take on a certain amount of pragmatism, that is part and parcel of the rhythm of this work. I think there are benefits to be had from it, to be rigorous in how we capture what's happening in the projects that we do have, what's happening, and how we can share that. I think I'm always so up for coming into these spaces where I'm sure within this room, how we can create space where we can share that information so it can be mutually beneficial in these conversations for, kind of presenting the case for the value, I mean the literal value of, and even if you have no heart, the cost savings that can be made by having created part of the delivery of care.
Thank you. Brilliant.
And can I just come back on that, because the National Arts in Hospitals Network is doing precisely that. We're pulling together the evidence base because we realise that this is so important. And I think it's about changing the feeling within hospitals that art is a nice to have, to art absolutely being intrinsic to creating healing environments and creating support for patients and staff. It's not just a prettification, it's part and parcel of delivering good healthcare.
I just wanted to add, so I think there are certain places as well, there are certain subjects where art and creativity can actually massively support the clinical need. So I was just hearing of an excellent example from Laura Waters, who was saying that the dermatologists are using art and describing colour and skin colour in art. So they're taking them around to art galleries they're using a collection and they're practicing their skills on those artworks. They're experiencing the art and really enjoying that aspect of it, and that's been really good for their health and well-being, but also they've actually become better at describing skin colour and condition, so they'll be better diagnosticians. And I wonder, I mean, I know at least of one other place that I think it'd be really, really important to get more arts and creativity into the hospital ward, and that's in the stroke unit. Ingrid, do you want to give me some facts about what makes people better?
Yeah, thank you very much, Esther, and it's been brilliant to listen to everyone, so thank you. Yeah, the stroke ward is an amazing place where, you know, creativity is so important. We have a lot of patients who are in hospital for a long time, and we should give people 45 minutes of therapy a day. That's gone up to 3 hours of therapy a day. And it's very difficult to do that when you look at the resources we have. But I think engaging ways of linking with creative health is so important. We've met up with Esther talking about getting music on the ward, getting patients and families involved in projects together. We're really lucky because we're on a very new unit and we have actually got some artwork, which was amazing. And it is very, you know, people find that very soothing and you know, a lot that they can concentrate on. But I think there are lots of other aspects that we could use. And I know that people have been involved in acting in some projects and brought really meaningful projects together in their time that they're on hospital. So it's something that we're really keen to explore. So it's great to hear about everybody's ideas, because I think at the minute, you know, creative arts, certainly where I work, is very underrepresented, you know, for patients who are actually on the ward, let alone the staff.
And there's you know, that clinical need, which is in that first 3 weeks after a stroke. There's, you know, your synapses are being knitted back together by what you're doing. So that's why the sort of the support that creative health could give the clinicians. Yes, people will need physio. Yes, they will need, you know, their medicine. They need to, you know, see their clinicians. But what else could we be putting in around patients to support that? I think that it's a really important area. Has anyone else got? Sorry, Ruth.
I was just going to say, on our stroke wards, we bring musicians in, and the effect of music is extraordinary in terms of relating and engaging with patients who may not have been communicating, and in terms of just creating a very different environment and engaging with patients in a very different way. So it has incredible power, music.
But also that whole, I just think the ability to play. You know, being ill is a serious business and it can be quite depressing, but actually giving people the chance to muck about a bit and use that other bit of their brain that might help. It's, you know, and of course I've worked in dementia a long time, so we know that, you know, your memory for song is stored in a different place to language, so actually you can still sing even though you might not be speaking. So there's just amazing work that creativity can bring out and to support people.
I think it's also a way of finding the person behind the illness and the individual. We brought an electric guitar player into a stroke patient who had obviously he had a huge collection of electric guitars at home. We managed to find him an electric guitar to play, and he became a different person. I didn't realise what a different person until the player had gone and he was back to a state of confusion. But whilst he was there in the room talking about Fenders and other electric guitars and just having a jamming session, that was the person who had, before the stroke, that was returned. It was quite extraordinary.
Wonderful, thank you. I'm looking at the time and I think we probably need to be bringing this to a close, but I just wanted to share one or two more slides to finish our session off today. And I just wanted to show you, oh, there you go, not that one. So if you're interested in this subject and you want to keep in touch, there's the Creative Health Hub on the NHS Futures platform. So that's where we've got a National Centre for Creative Health. We've created a little place where there's news and information, and there's sort of, you can contact your creative health associate in your place, because there are 7 of us across the country in England only. You might want to upload an illustrative example of creative health and in hospitals on the Creative Health Toolkit website. So there's a link there. If you've got any more strategic links that you think people that I need to be talking to in Kent, Surrey, Sussex, Bucks, Berks, Oxford, Hampshire, or the Isle of Wight, please do email me. That's my email there. And there's a picture of the NHS Futures platform. And the other thing is just keep in touch. So there's the National Centre for Creative Health website that you'll find the Creative Health Review, links to the Creative Health Toolkit. There's my Creative Health Southeast News email. So I send out an ad hoc email with some information about what's going on in creative health. It might be a new resource or some training for arts practitioners, etc. It's not very long and it's just a little update. It's a nice way of keeping in touch. So if you want to sign up for that, please do. And do follow us on socials. I've said that so I don't have to say the dreaded word, what used to be Twitter. X. So there's the National Centre for Creative Health's website, X account there, and my own one as well, which is All Things Southeast. And lastly, if you're still there, which some of you are, I just wanted to read out this amazing quote, which is on the Creative Health Review, the first one, the original, and it's a quote from Matt Walsh, the Chief Executive of Calderdale CCG, and he says, "The relationship between arts and health is understood in our experience of the world, and for those of us who have spent years of our lives working with people in difficulty with their health and well-being, it's always been clear that whilst medicine and related disciplines can help to solve many problems, the fundamental issues which confront us at a human level are to do with our relationship with ourselves, with those close to us, and the community that we wish to be a part. Art can help us to tell new stories which will take us to new places, and art can help us to tell the old stories in a way that connect at a deeper level." And I love that quote because it's really about how it's about healing. And that's what this was about. So thank you so much for joining us. Please do keep in touch, be part of this story, because it's so interesting and it's so important to support people and you and people working within the health service. So thank you.